Benito Juárez. For many Mexican citizens, Benito Juárez remains the most highly regarded of presidents and to these days is the only Mexican president honored with the title of Benemérito de las Américas, Hero of the Americas. In his honor, our university celebrates the Juárez Week.
Mexico had 3 presidents. In addition to political instability, the country also suffered natural disasters and epidemics. No wonder Rosenberg, 1987, calls the 19th century the century of cholera. Mexico suffered many cholera epidemics. That on 1833 was particularly disastrous. In the first half of the century, epidemics of typhus, influenza, yellow fever, and malaria were very severe. The consequences of the epidemics were so serious that in 1832, the government decided to absorb the expense they caused. This is the timeline of what happened in 1801 to 1833. First, 1801, the first typhoid epidemic occurred. 1805, measles was present. 1808, epidemic smallpox hits the world. 1816, René Laennec invented the stethoscope. Nowadays, the stethoscope is one of these materials that we all associate with a doctor. 1820, the hospital's orders were suppressed and from then on the hospitals depend on the city council. 1825, the government expressed great interest in increasing its power in health matters. He made health laws, bodies, and entered into an open opposition with the church regarding the regulation of hospitals and cemeteries. 1826. Abel Victorino published the work Influence on the Different Climates of the Universe on a Man and in particular the influence of the climates of South America. 1831. The pro-medical court regulated medicine and those who practiced it when it was replaced by the medical faculty of the federal district. 1833. Finally, Vice President Valentin Gomez Farias, an intelligent man with a strong character, created the medical science establishment.
Dr. Luis Muñoz. He was the first professor of surgery in the new establishment of medical sciences. He served as vice president of the Academy of Medicine in Mexico. He published articles of corneal staphyloma and strabismus.
1833 was particularly disastrous. In the first half of the century, epidemics of typhus, influenza, yellow fever, and malaria were very severe. The consequences of the epidemics were so serious that in 1832, the government decided to absorb the expenses they caused. 1841. The Superior Health Council was established in Mexico, composed of only 6 members and belonging to the branch of public charity.
Dr. Jules Clement, of French nationality, he arrived in Mexico in the year 1849. Unlike most of the ophthalmic surgeons of the 19th century, he distinguished himself from his cataract operations, discovering the advantages of the linear incisions for cataract extractions.
Dr. José María Bertiz y Delgado. He was one of the first to operate on cataracts. In 1854, he founded a consulting room for eye patients at the Hospital de Pobres, where he performed around 102 operations.
1856. President Benito Juárez confiscates the assets of the church, placed in hospitals and orphanages under government control.
(1866) Empress Charlotte founded the maternity home in the department of Hindenburg of the Hospital for the Poor. 1867 The first national school for the deaf and dumb was founded in Mexico by decree of Juárez himself, establishing the inclusion of all persons with this disability in Mexico. 1868 The Dr. Luis Fernandez Gallardos establishing a ward for sick children at the Hospital de San Andrés. 1869 He founded the Hospital de Maternidad e Infancia, the first independent institution in Mexico for the care of children's health problems. 1870 An interest in hereditary diseases is emerging among Mexican physicians. 1871 At the Juárez Hospital in Mexico, he performed the first excision of the anus and portion of the rectum via the perineum in America. 1879 The Council formulated a national medical pharmaceutical was an important action for public health care because it sought to unite medical care and preventive medicine. 1880 The Boletín del Consejo Superior de Salubridad, Boletín del Consejo 1880, the first Mexican publication on public health, appeared. 1881 The Reglamento de Beneficencia appeared, and its main idea is the right to medical aid and the duty of society to contribute to it. 1882 The Hidalgo Council of Health issued the law against infectious and contagious diseases. 1883 The basis of the project for the organization of public hygiene services were presented. 1884 A new sanitary code was enacted which changes were merely administrative, such as the disappearance of the word ministry and the replacement of the word secretary, supposedly with a new substantive technical changes. 1891 The first sanitary code of the United Mexican State is approved and preventive medicine. 1894 At the two Mexican Medical Congress held in San Luis Potosí, Liceaga proposed the formation of a large hygiene commission to unify sanitary laws throughout the Republic. 1895 The preliminary project for the constitution of the General Hospital of Mexico was presented. 1897 On April 1, 1897, President Porfirio Díaz announced the formal start of construction of a state-of-the-art hospital.
In 1897, the use of X-rays was implemented to detect different conditions like fractures and other injuries. In 1905, the first public hospital was inaugurated in Mexico City. In 1907, the nursing school was founded, which was responsible for training nurses professionally. In 1910, the Mexico Red Cross was founded. In 1918, the influenza pandemic occurred in Mexico. In 1921, the Institute of Hygiene was founded in Mexico. In 1922, the School of Health was founded. Was responsible for promoting hygiene and preparing health professionals. In 1925, Mexico subscribes to the Pan American Sanitary Codes. In 1925, the first successful blood donation was made. In 1949, the National Association Child Protection Agency was founded. In 1929, vaccination campaigns against smallpox were carried out due to an increase in cases. In 1929, the School of Medicine in UNAM was founded.
(1929) Public health in Mexico in that year was in the process of expansion and improvement, with the government taking more active measures to protect the health of the population and improve sanitary conditions throughout the country. 1930, the country was in the process of urbanization and industrialization, and the government implemented various policies and programs to improve the health of the population. However, medical care was limited and many people did not have access to quality health services. 1931, various public health programs were carried out to combat diseases such as tuberculosis, typhoid fever, and poliomyelitis. The Department of Public Health was created and hospitals and clinics were built throughout the country, but medical care was still limited in many rural areas. 1932, the prevalence of diseases such as tuberculosis remained high, but despite these challenges, advances were being made in medical research and in the training of health professionals. The creation of the Secretaría de Salubridad in 1921 had laid the foundation for a more organized and efficient health system. The National Institute of Cardiology was founded in Mexico City to provide specialized medical care for heart disease. 1933. 1934, the National Institute of Nutrition is created in Mexico City to research and promote healthy eating habits and combat malnutrition in the country. 1935, Social Security is established in Mexico with the creation of the Mexican Social Security Institute to provide health services to formal workers and their families. 1936, the first vaccination campaign against yellow fever was carried out in Mexico as part of the efforts to control infectious diseases in the country.
1937. The Sindicato de los Trabajadores de los Servicios Médicos del Departamento del Distrito Federal was founded. 1938. The World Health Organization included the vaccine against yellow fever in the list of preventive drugs in 1838, after more than 5 centuries of causing deadly epidemics on the planet. 1939. Mexico inaugurated the Institute of Health and Tropical Diseases, a center devoted to conducting scientific research on the many technical and sanitary problems that were affecting the country, especially a series of diseases. 1934 to 1940. Held during the Cardenismo consists of 4 studies: medical sanitary aspects in Mexico by Marta Eugenia Rodriguez, campaigns against diseases by Carlos Viñesca Treviño, hospitals during the Cardenism by Guillermo Fajardo Ortiz, and military medicine in Mexico by Antonio Moreno Guzmán. Through them is given an integral vision of the state of health and illness during the administration of General Lázaro Cárdenas del Río, the first decennial president government of the 20th century.
The influence of social medicine was greater during the first 5 years of the 1940s and based on an organizational chart of the DSP in 1942. It can be seen that the different technical and administrative sections developed well-defined tasks, in which some subjects taught at the school played a fundamental role because medical graduates and interns in social services were sent to work in the country's ejidos. Our health system is almost 60 years old. Its foundation dates back to 1943, the year in which the Secretariat of Health and Assistance, today the Secretariat of Health, SSA, the IMSS, and the Children's Hospital of Mexico, considered the first of the national health institutes were created. The struggle for disease eradication and the promotion of a culture of prevention among the Mexican population of the time made it necessary to train sanitarians who would contribute to the national reconstruction period. This trend continued until 1945, when social medicine started to be considered as a flag of action in the field of disease prevention, which promoted actions and policies focused on the rural communities of Mexico. In 1946, the nursing school was founded at the Dr. Ruben Linero Hospital with recognition from the Doctorate of Professions. On April 2nd, 1947, the Mexican-American Commission for the Eradication of Foot and Mouth Disease was established, agreeing on a campaign of inspection, quarantine, and sacrifice of sick animals, a measure that became known as the sanitary rifle, and where an average of 2 were eliminated, 1,000 head of cattle and pigs a day, the ranchers were compensated, and the facilities were disinfected, promoting the introduction of new animals until it was confirmed that they were free of foot and mouth disease.
1948. Despite these actions, the disease continued to expand in the center of the Mexican Republic, and after analyzing the situation, it was decided to incorporate the vaccination into the program, starting activities at the beginning of the 1948 with vaccines imported from Europe, which 8 months later were produced in Mexico.
In September 1949, construction began on a laboratory for animal health diagnosis in Palo Alto, Mexico City.
In 1961, President Benito Juárez decreed the National Council of Public Charities and therefore coordinate charities and hospitals to convert them into a public service dependent on the state.
In 1960, Mexico carried out campaigns to eradicate disease such as malaria and smallpox, achieving significant progress in the reduction of cases. Then, in January 31, in 1961, the National Institute of the Protection of Children was created. Then, in 1970, family planning programs were implemented in Mexico to control population growth and improve maternal and child health. In 1981, we had the first cases of AIDs. It was not until 1984 that scientists discovered that human immunodeficiency virus, HIV, was the cause of AIDs. Finally, in January 27, in 1987, the National Institute of Public Health was created.
In 1993, the first Mexican official norm was created to address the prevention and control of HIV, and in 1995, it was established the Health Sector Reform Program 1995-2000. On June 3, 1996, the National Medical Arbitration Commission was created. The Undersecretary of Disease Prevention and Control was created in 1997, and the following year, the Epidemiological and Statistical System of Deaths was also created. In 2000, Mexico signed the commitments to eradicate polio during the World Summit for Children.
eliminate neonatal tetanus, reduce mortality by 95%, and reduce morbidity caused by measles by 90%. Julio Frank graduated as a surgeon from UNAM and at the University of Michigan. Between 2000 and 2006, he served as Mexico's of Health of Mexico. He has held senior position at the World Health Organization, the Mexican Foundation for World Health Organization, the Mexican Health Foundation, the Bill and Melinda Gates Foundation, and the Carso Health Institute. Since 2006, Regional Public Health Research, located in Tapachula, Chiapas, and created in 1979 by an initiative signed by the Pan American Development Organization Health and the Ministry of Health and Assistance. Among the communicable diseases were dengue fever and pulmonary tuberculosis, of which only between January and July 2007 identified 8,871 new cases. In 2008, the Department of Tobacco Research carried out an intervention against smoking in 10 secondary schools, with counter-advertising aimed at combating the smoking tobacco industry. And the investigation conducted by this department served to promote and evaluate local smoke-free laws since 2008. Other researchers participate in the 2008 National Addiction Survey in collaboration with the National Council Against Addictions. In 2009, the Mesoamerican Institute of Public Health was created. To formalize its creation, a meeting was held of Ministers of Health in Quintana Roo. In 2010, the National Health Agreement Food was created. That means a strategy against overweight and obesity, regulation and promotion for the proper use of antibiotics in Mexico. In 2011, the adoption of the pandemic influenza preparedness framework paves the way for equitable access to pandemic response measures. Between 2012 and 2018, three important things happened. The first one was the important advances were made in HIV research in Mexico, including studies of the epidemiology of the disease and the development of a new antiretroviral therapies. The second one was in Mexico became the first country to approve the use of dengueatia, the first dengue vaccine for people aged 9 to 45 years in endemic areas. This milestone represents a significant advance in the prevention of a disease that is a public health concern in several regions of the country. And lastly, Jose Narro Robles, he was Mexico's Secretary of Health from 2016 to 2018 and led several initiatives to improve public health in the country. Another three important things what happened in the period of 2019 and 2024, and the first one was in 2019. That was an important development of global health was the World Health Organization's declaration of a coronavirus disease outbreak as a public health emergency of international concern on January 30. This outbreak began in the Chinese city of Wuhan and spread globally. The second one was in 2020, and that was an important event in global health, was the World Health Organization declaration of the COVID pandemic on March 11, 2020. This statement underscored the severity and global spread of the virus. And lastly, in 2020, a pivotal event in global health was the development and rollout of the several COVID vaccines. These vaccines represented a significant milestone in the fight against the pandemic and offered hope for controlling the spread of the virus and protecting the world's population against serious disease. In 2023, it was the rise of mental health awareness in action, especially after the challenge and stress experienced during the COVID-19 pandemic. An increased focus on mental health promotion, stigma reduction, and expansion of mental health service was observed in many parts of the world.